watching your home team at 5 with Mike Dimmick, Gina Morse, and Lee Ranson's Weather First forecast. This is News 25 Live at 5.
Your health news is just ahead on Live at 5. We'll talk to the president of the Illinois State Medical Society. Plus, tonight's Health Matters guest is Dr. Stephen Malkin, president of the Illinois State Medical Society, a board-certified specialist in internal medicine. Dr. Malkin is a member of the Medical Care Group in Arlington Heights and serves on the medical staffs of Alexian Brothers Medical Center and Northwest Community Hospital, and he's a fellow of the American College of Physicians. Welcome.
Thank you.
I want to start with really a pointed question about we in the media. What do you think, as a doctor, that we do right and, frankly, what we do wrong when covering medical stories?
Well, I think the important thing for medical stories is to let patients know about something, and if it sounds like it may affect them or apply to them, that they then go speak with their physician to see how it actually does. A lot of times what it does, it scares people, or they treat themselves or do something on their own without getting reliable medical information on how it actually applies to them.
In other words, we need to give more context and encourage people to talk to the doctors first.
Well, I think it's good to bring up the topic so that people are aware of it, but then if it sounds like it applies to them, make sure they know that they should go talk to their own doctor. And, you know, same with statistics when it comes out. It doesn't apply to one individual, so just because a group does something, it doesn't mean for any one person that it really applies to them.
What do you think the greatest issue is facing folks like you, people in the medical field right now in Illinois?
Well, a concern we have are really the access to health care for patients. There's a number of problems with payment issues we've had. Medicare's been threatening to, or is scheduled to have a pay cut for us for 23% in December, 30% in January if Congress doesn't do something. And the worry is that Medicare patients then won't have access to physicians, because I don't know any physicians that can sustain a 30% pay cut. And we know from a survey of our Illinois physicians that many have looked at not taking new Medicare patients or cutting back on the Medicare patients they see, which is certainly a huge problem when you have the largest segment of the population going into Medicare.
It sure is. Well, Dr. Malkin, thanks for spending a couple of minutes with us tonight. We appreciate it.
Well, thank you. It's nice for having me.
And still ahead on Live at 5.